Hi everyone, welcome back to my YouTube channel and today we are going to talk about deep cervical fascia. So let's start our topic with introduction. Deep cervical fascia is a dense connective tissue layer that surrounds and compartmentalizes the structures of the neck. It provides protection, structural support and pathways for infection spread. Fascia is divided into several layers which form facial spaces, sheaths, and compartments in the neck, making it highly significant in clinical anatomy and surgery. Functions of deep cervical fascia: it provides a protective sheath for neck structures. It separates and supports muscles, vessels, and viscera. It reduces friction between structures during movement, like swallowing and turning the head. And it creates potential spaces for infection spread. It also helps form surgical planes for safe dissection. Layers of deep cervical fascia. Deep cervical fascia consists of three main layers. They include investing layer, pretracheal layer, and prevertebral layer. First is investing layer. It is the outermost layer that completely encircles the neck. Its attachment includes superiorly it is attached to external occipital protuberance, superior nuchal line, mastoid process, and mandible. Inferiorly, it is attached to mandibular sterni, clavicle, acromion, and spine of scapula. Posteriorly, it is attached to ligamentum nuchae, and content enclosed by investing layer includes sternocleidomastoid muscle and trapezius muscle, and also submandibular and parotid gland from that they form their capsules. Next layer of deep cervical fascia is pretracheal layer, that is thin fascia around visceral structure of the neck. It is located at the anterior part of neck and it extends from the hyoid bone to the pericardium in the thorax. It encloses thyroid gland, trachea, esophagus, and is attached to hyoid bone superiorly, and it blends with pericardium inferiorly. Third layer of deep cervical fascia is prevertebral layer, that is thick fascia that cover deep muscles of the neck. They include prevertebral and scaleni muscles. It extends from skull base to thoracic vertebra. It forms the floro-posterior triangle of the neck. It creates the axillary sheath for brachial plexus and subclavian artery. Carotid sheath. It is a tubal facial condensation that is derived from all three layers of deep cervical fascia. Its contents include common and internal carotid arteries, internal jugular vein, and vagus nerve, that is 10th cranial nerve. It also has deep cervical lymph nodes and sympathetic nerve fibers that are also called as carotid plexus. And it extends from base of skull to the root of neck. Retropharyngeal space. It is a potential space between prevertebral fascia and buccopharyngeal fascia that is part of pretracheal layer. It extends from skull base to posterior mediastinum, and it is clinically important because infection here can spread to the mediastinum. Facial spaces of the neck. It includes pretracheal space that is present between investing and pretracheal fascia, and it communicates with anterior mediastinum. It has retropharyngeal space that is present behind the pharynx, and infection can spread to posterior mediastinum from this area. And it has danger space that is between alar and prevertebral layer, and infection can spread rapidly to the thorax from this area. Clinical significance of deep cervical fascia. First is infection spread. A special compartment acts as a channel for infection to travel from neck to thorax or mediastinum. Second is surgical anatomy, as they provide natural cleavage plane for surgeries like thyroidectomy and neck dissections. Third significance is carotid sheath importance, as it is used as landmark for vascular surgery, catheter placement, and anesthesia. Fourth significance is neck trauma protection, as deep fascia helps compartmentalize bleeding and swelling, thus limiting damage to vital structures. Conclusion of this lecture video. Deep cervical fascia is a vital connective tissue structure that protects and separates the neck muscles, vessels, and viscera. Its layers, compartmentalized and spaces are crucial in understanding infection spread, surgical approaches, and trauma management. Knowledge of this fascia is essential for clinicians, surgeons, and anatomists. And this was all about deep cervical fascia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.